All right, so you're ready for another deep dive? Today we're tackling something that I think a lot of you are probably curious about, and that's Salmonella.
Uh-huh.
We've gotten a ton of questions from you guys about it, and so we figured it was high time we took a closer look. And to really illustrate how Salmonella works, we're going to use a fictional case study based on the OpenStax Microbiology textbook.
Okay.
You can find a link to that textbook in the show notes, by the way, if you want to learn even more.
Great.
So let's jump right in. We're going to meet 4-year-old Carli, total sweetheart, loves her some fried eggs. But on this particular day, her eggs were a little bit runny, like maybe the yolk wasn't totally cooked through. And, it's kind of where our story starts to take a bit of a turn.
Yeah.
Because later that night, Carli wakes up, she's got a fever, she's throwing up.
Right.
And then, of course, the next day, the diarrhea hits.
Not a fun situation.
No, definitely not. So understandably, her parents are freaking out. I mean, who wouldn't be? They rush her to the ER, and it's just a scary situation all around, especially when it's your kid,
Absolutely. It's really hard to see your little one go through something like that. So what happened at the hospital? Did they figure out what was wrong?
Well, that's where it gets really interesting, and this is where I think having an expert like yourself is really valuable.
Sure.
What were the the clues, the red flags that made them think, okay, this looks like Salmonella?
Right. So Carly's symptoms are actually pretty typical for a lot of different stomach bugs, the fever, the vomiting, the diarrhea. But what really helped pinpoint Salmonella was the lab work they did. Specifically, they found gram-negative bacilli in her stool sample. Now, I know that sounds super technical, but let me break it down for you. Gram-negative, that's just a way we describe bacteria based on how they react to a specific staining test we use in microbiology. It's kind of like a quick identification trick. And bacilli, that just means the bacteria are rod-shaped. So when you put all that together, it really points us towards Salmonella as the most likely culprit.
Ah, okay, so it's like a puzzle, and those are the pieces.
Yeah.
But this is where I have a question.
Yeah.
You said that Carli loves fried eggs, and those runny yolks, were those kind of like the entry point for the Salmonella to get into her system?
Exactly. Raw eggs can sometimes carry Salmonella bacteria, and the heat from cooking, normally it would kill those bacteria. But when the yolk is runny, it means that part of the egg might not have gotten hot enough to eliminate all the Salmonella. So in a way, yeah, those undercooked eggs basically gave the Salmonella a free pass into Carli's gut.
I see. That makes a lot of sense. Now, there's something else that really surprised me about Carli's case. Her doctor didn't prescribe antibiotics right away.
Mm-hmm.
And I always thought that, with bacterial infections, that was like the standard first step.
Right, and it is for a lot of bacterial infections, but Salmonella can be a little tricky. Sometimes antibiotics can actually backfire.
Really?
Yeah, they can actually worsen the situation. What happens is antibiotics, while they kill bacteria, they can also disrupt the natural balance of your gut, the good bacteria that live there and help you digest and all that. And sometimes disrupting that balance can actually slow down your body's own natural defenses against the Salmonella, kind of prolonging the whole ordeal.
So in Carli's case, if antibiotics weren't the best approach, what helped her get better?
So what they focused on with Carli, and what's often the most important treatment for Salmonella, is rehydration.
Yeah.
With all that vomiting and diarrhea, she was losing fluids like crazy. And when you get dehydrated, especially a small child, it weakens your body's ability to fight off infection. So rehydration therapy, what it does is it replaces those lost fluids and electrolytes. Electrolytes, those are things like sodium and potassium, really important minerals that help your cells function properly. And by restoring those electrolytes, they were essentially helping Carli's body get back on its feet and fight off the infection.
So the rehydration worked, she got better.
It did. She recovered really well after a couple of days of rehydration therapy. Her fever went down, the vomiting stopped, the diarrhea cleared up, and best of all, when they did another stool test, there was almost no Salmonella left. Her body had successfully fought it off.
That's amazing.
Yeah.
So really Carli's case is, well, it's definitely a reminder to make sure those eggs are cooked all the way through.
Right.
No runny yolks.
Yeah, no runny yolks.
But it also highlights, for me at least, how incredibly powerful our own bodies are in fighting off these bugs. Sometimes giving our bodies the support they need, like with rehydration, is the best way to go, rather than automatically reaching for antibiotics. It really makes you think differently about food safety, not just in terms of what we eat, but also how we prepare it.
Absolutely. It's about taking a holistic view, being mindful of what we're consuming, how we're handling it, and trusting our bodies to do their part as well.
So for everyone listening, here's something to ponder. After hearing Carli's story and learning about Salmonella. How do you approach food safety in your own kitchen? We'd love to hear your thoughts in the comments.
Yeah, chime in. We're always interested to hear your experiences and tips.